Brain tumors. A brain tumor, known as an intracranial tumor, is an abnormal mass of tissue in which cells grow and multiply uncontrollably. There are two main groups of brain tumors, the primary and the metastatic ones. The primary brain tumors include tumors that originate from the tissue of the brain or the brain's immediate surrounding. The primary brain tumors include the glial or the non-glial. The glial ones are composed of the glial cells. The non-glial ones are developed on or in the structures of the brain, including nerves, blood vessels, and the glands. The other type are the benign or the malignant ones. Metastatic brain tumors include tumors that arise elsewhere in the body and migrate to the brain, usually through the bloodstream. Metastatic tumors are considered cancerous and are malignant. Types of benign brain tumors. The first one is chordomas, which is mostly seen in the base of the skull and the lower portion of the spine. Then we have craniopharyngiomas, usually arise from a portion of the pituitary gland. Gangliocytomas, which include neoplasms of nerve cells. Glomus jugulare, common form of glomus tumor located at the top of the jugular vein. Meningiomas originates from the meninges. Pineocytomas, which arise from the pineal glands. Pituitary adenomas, which affect the pituitary gland. Schwannomas, which are the most common benign brain tumors in adults. Acoustic neuromas are the most common schwannomas. Types of malignant brain tumors includes gliomas. These are the most prevalent type of adult brain tumors. They arise from the supporting cells of the brain called glia. These cells are subdivided into astrocytes, ependymal cells, and the oligodendroglial cells. Glial tumors include the following. Astrocytomas arise from astrocytes. Ependymomas arise from ependymal cells. Glioblastoma multiformes are composed of several different kinds of cells. Medulloblastomas arise from the cells of the cerebellum. Oligodendrogliomas arise from oligodendrocytes. Other types of brain tumors include hemangioblastomas and the rhabdoid tumors. Risk factors for brain tumors are increasing age, gender, that is, males are more prone to develop brain tumors as compared to females, occupational hazards, that is, exposure to solvents, pesticides, oil products, and rubber. Hereditary factors. 5% of the brain tumors are linked with genetic factors including Frohman syndrome. Exposure to infection like Epstein-Barr virus increases the risk of CNS lymphomas. Electromagnetic field, ethnicity and race, ionizing radiations, exposure to nerve agents, and N-nitroso compounds, for example, cigarette smoking and cosmetics. Clinical features of brain tumors: headache and seizures. Headache worsens on coughing, changing posture or walking. Seizures can be demonstrated as convulsions, loss of consciousness on bladder control. Difficulty with language, that is, they might develop aphasia or dysarthria. Dysarthria is difficulty in speaking articulated words. Mood and personality changes. Changes in vision, hearing, and sensation, which includes blurred or double vision called as diplopia. Partial or total loss of vision. Tinnitus in the ears, nystagmus. Motor deficits, which includes weakness or paralysis of muscles, difficulty with coordination, control, and voluntary movements, loss of balance. Signs of increased ICP, that is intracranial pressure. We have 5 P's. So P for papilledema, persistent headache, persistent disturbances, projectile vomiting, and sixth nerve palsy, sensory impairment and altered conscious state. Other symptoms include difficulty in swallowing, facial paralysis, sagging eyelids, fatigue, disturbed sleep pattern. Let's see the symptoms depending upon where the tumor is located. In the frontal lobe, muscle weakness, temporal lobe, seizures and aphasia, occipital lobe, visual problems, parietal lobe, loss of sensations. Diagnosis includes detailed history of clinical manifestations and familial history, exposure to carcinogen, and occupational history is taken. Neurological clinical examination, that is a detailed examination which includes higher mental function, cranial nerve examination, sensory system, reflex testing and motor examination, MRI to measure the tumor size, CT scan, PET scan which is positron emission tomography, cerebral angiogram or arteriogram, series of X-ray of the head that shows the arteries. Lumbar puncture, that is the CSF is drained to look out for tumor cells. Myelogram uses a dye injected into the CSF and X-ray is taken. Biopsy to diagnose cancer. ESR, skull X-ray, thallium SPECT and tumor marker. Management widely depends upon the following factors, that is size, type and grade of tumor, metastasis, possible side effects, extent of damage on the vital parts by pressure, patient's overall health condition. Most common treatment options include surgical management. The neurosurgeon's challenge is to remove as much tumor as possible without injuring the brain tissue. The first one is craniotomy. The skull is opened to access the tumor and remove as much as possible. A drain may be left in the brain's fluid cavities at the time of surgery to drain the normal brain fluid as the brain recovers from the surgery. Stereotactic biopsy. A frame is attached to the patient's head. A scan is obtained and the patient is taken to the operating area where a small hole is drilled in the skull to allow access to the abnormal area. A small sample is obtained for examination under microscope. The third one is cortical mapping, image guided surgery. Fourth one, surgery in eloquent areas. Fifth one, ventriculoperitoneal shunting may be required for some people with brain tumor. After surgical management, we have radiation therapy. Radiation therapy is the use of high energy X-rays or other particles to destroy the cancer cells. It helps in slowing or stopping the growth of the tumor. The most common type of radiation therapy is called external beam radiation therapy, in which radiation is given from a machine outside the body. Radiation therapy can be also given by using internal implants called as internal radiation therapy or brachytherapy. External beam radiation therapy can be directed at the tumor in the following ways. Conventional radiation therapy, the location is determined by anatomical landmark and X-ray. Three-dimensional conformal radiation therapy, that is 3D CRT. A 3D model of the tumor is created on the computer and is used to aim radiation beam directly on the tumor. Proton therapy. Here the protons are used in the radiation instead of X-rays. Stereotactic radiosurgery is the use of a single high dose of radiation given directly onto the tumor and healthy tissue is not involved. Intensity modulator radiation therapy, that is IMRT. It is similar to 3D CRT, that is three-dimensional conformal radiation therapy, and can deliver high dose of radiation. Adverse effects of radiation therapy includes fatigue, skin reaction, hair loss, acidity and indigestion, neurologic deficit, memory deficits and cognitive deficits. After radiation therapy, we have chemotherapy. It is the use of certain drugs called chemotherapeutic agents that have the capacity to destroy cancer cells or slow down the ability to grow and divide. Systemic chemotherapy gets into the bloodstream and enriches the cancer cells, usually administered by oral or IV, that is intravenous route. Some chemotherapeutic agents are gliadal wafers, temozolomide, procarbazine, lomustine, vincristine, methotrexate, hydroxyurea. Adverse effects include fatigue, risk of infection, nausea and vomiting, hair loss, loss of appetite and diarrhea, kidney damage. Then we have targeted therapy. It targets the tumor specific genes, proteins, and promotes survival. Anti-angiogenesis is one type of targeted therapy which is used for brain tumors. The drug used is bevacizumab. Alternating electric field therapy. It makes use of a non-invasive portable device which is given by placing electrodes that produce an electric field on the outside of the patient's head. Laser interstitial thermal therapy. This involves placing a tiny catheter within the lesion, possibly completing a biopsy, then using a laser to thermally ablate the lesion. Then we have investigational therapies, which includes immunotherapy, gene therapy, and differential therapy. And lastly, we have palliative or the supportive care. This focuses on reducing the symptoms, improving the quality of life, supporting the patients and their family members. The important aspects of palliative care includes physiotherapy, psychological counseling, nursing, administration of corticosteroids, anticonvulsants, and painkillers.